Effects of irregular periods on body. Menstruation is a natural process that occurs in women of reproductive age. A typical menstrual cycle lasts around 28 days, but it can vary between 21 and 35 days. However, many women experience irregular periods, which means their cycle is shorter or longer than usual, their flow is too heavy or too light, or they have unexpected spotting between periods. Causes of irregular periods. Irregular menstrual cycles often result from hormonal imbalances, specifically changes in estrogen and progesterone levels. Several factors can contribute to this, including polycystic ovary syndrome (PCOS), a common condition affecting hormone levels. Birth control methods, pills, intrauterine devices (IUDs), and hormonal changes can disrupt cycles. Breastfeeding can cause irregular or missed periods. Thyroid disorders. Both hyperthyroidism and hypothyroidism can interfere with menstruation. Lifestyle factors, stress, excessive exercise, obesity, and smoking can also impact cycle regularity. Health effects of irregular periods on the body. Having irregular periods isn't just inconvenient. It can also be a sign of underlying health issues. Some of the effects of irregular menstruation on the body include hormonal imbalances. Disruptions in estrogen and progesterone can lead to mood swings, fatigue, and acne. Increased risk of metabolic disorders. Irregular periods have been linked to metabolic syndrome, which raises the risk of heart disease and type 2 diabetes. Heart health issues. Studies suggest a connection between irregular cycles and coronary heart disease. Fertility problems. Women with irregular periods may have difficulties conceiving due to inconsistent ovulation. Pregnancy complications. Menstrual irregularities before conception can increase the risk of complications, such as high blood pressure during pregnancy. Weakened bone health. Long-term hormonal imbalances can lead to lower bone density, increasing the risk of osteoporosis. Now, let's go deeper into these effects. Understanding these risks can help women take proactive steps to protect their health. 1. Metabolic syndrome and irregular periods. Metabolic syndrome includes a group of health problems such as high blood sugar, insulin resistance, high cholesterol, and high blood pressure. Women with irregular periods often have a higher risk of obesity, diabetes, and hypertension compared to those with regular cycles. Studies show a strong connection between polycystic ovary syndrome, PCOS, and metabolic syndrome. Women with irregular cycles are more likely to have high triglycerides, high waist circumference, and low good cholesterol (HDL) levels. Irregular menstruation may be an early warning sign of prediabetes and type 2 diabetes, making early screening essential. 2. Link between irregular periods and type 2 diabetes. Type 2 diabetes occurs when the body loses its ability to regulate blood sugar properly due to insulin resistance. Women with long or highly irregular menstrual cycles have a higher risk of developing type 2 diabetes. Irregular periods might indicate insulin resistance, a key factor in diabetes development. Symptoms like missed periods, amenorrhea, or infrequent periods, oligomenorrhea, in young women could be early signs of metabolic disorders that impact health later in life. 3. Heart disease risk and menstrual irregularities. Women with irregular cycles have a 28% higher risk of coronary heart disease compared to those with regular periods. PCOS, a common cause of irregular periods, is linked to obesity, glucose intolerance, insulin resistance, and high blood pressure, all risk factors for heart disease. Hormonal imbalances can lead to high cholesterol and triglycerides, further increasing the risk. Estrogen, a natural heart protector, helps keep blood vessels healthy. Low estrogen levels, often seen in women with irregular periods, can contribute to heart disease. 4. Irregular menstrual cycles and rheumatoid arthritis, RA. Autoimmune diseases like rheumatoid arthritis, RA, are more common in women, and research suggests a connection between menstrual irregularities and RA risk. Women with very irregular menstrual cycles between ages 20 and 35 may have a slightly increased risk of developing RA. Estrogen and progesterone play a role in reducing inflammation, which is why some women experience fewer joint symptoms during pregnancy or certain phases of their cycle. Low estrogen levels, linked to irregular periods, may contribute to inflammation and autoimmune disorders. Irregular periods don't just affect reproductive health. They can also impact quality of life, work performance, and mental well-being. Many women experience pain, discomfort, and emotional distress due to menstrual irregularities, which can influence daily activities, productivity, and overall well-being. 5. How irregular periods affect quality of life. Menstruation is a natural part of life, but for some women, irregular periods cause significant disruptions in work, social life, and emotional health. Severe menstrual pain, dysmenorrhea. Around 10% of women with painful periods experience such intense discomfort that they become incapacitated for 1 to 3 days each cycle. This affects their productivity, personal health, and even global economic performance. Unawareness of abnormal cycles. Many women don't realize their menstrual patterns are abnormal, which can lead to untreated health conditions. Work and daily activities. Irregular periods are linked to reduced attention, endurance, and efficiency at work and school. Women with menstrual issues often feel less effective in social situations and daily tasks. Impact of heavy menstrual bleeding on well-being. Women with heavy menstrual bleeding report significantly lower quality of life, both physically and mentally. Research shows heavy checkmark greater impact on mental health than physical health compared to the general population. Heavy checkmark lower energy levels, reduced work productivity, and social withdrawal. Heavy checkmark strain on family life and intimate relationships due to fatigue and emotional stress. 6. Psychological and mental health effects of irregular periods. Hormonal fluctuations during the menstrual cycle can influence mood, emotions, and cognitive function. When periods are irregular, these effects may be worse and more unpredictable. Higher risk of depression and anxiety. Low estrogen levels, often linked to irregular cycles, can disrupt mental health balance, increasing stress, depression, and mood swings. Sleep problems. Research links irregular menstruation with short sleep duration and poor sleep quality, contributing to fatigue and emotional distress. Eating disorders and ADHD. Studies have found associations between menstrual irregularities and conditions like eating disorders, attention deficit hyperactivity disorder, ADHD, and psychiatric distress. Young age at menarche and mental health risks. Girls who experience early puberty, young age at first period, and irregular cycles may be at higher risk for anxiety and mood disorders. Because of this, doctors recommend considering menstrual patterns during psychiatric evaluations. 7. Anemia, low iron levels, and fatigue. Iron deficiency is a common issue for women, and heavy or irregular menstrual bleeding can significantly increase the risk of anemia. Nearly 30% of women worldwide suffer from anemia, with menstruation being the leading cause of iron deficiency. Longer or heavier periods can reduce serum ferritin and hemoglobin levels, leading to low energy, dizziness, and weakness. Fatigue and anemia caused by heavy menstrual bleeding can negatively impact quality of life, QOL, work performance, and emotional well-being. If you experience persistent fatigue, pale skin, or shortness of breath, it's important to check your iron levels and consider dietary changes or supplements. 8. Bone health, risk of osteoporosis. Women with irregular periods or missed cycles, amenorrhea, may experience low estrogen levels, which can weaken bones over time. Estrogen plays a key role in bone health by helping absorb calcium and promoting bone formation. Low estrogen levels reduce bone density, increasing the risk of osteopenia and osteoporosis. Women with long-term menstrual irregularities may be at higher risk for fractures and bone-related conditions later in life. Maintaining a balanced diet rich in calcium, vitamin D, and regular exercise can help support bone strength and prevent osteoporosis. 9. Fertility. How irregular periods affect conception. For women trying to conceive, irregular menstrual cycles can be a sign of ovulation problems, which may lead to infertility or difficulty getting pregnant. Women with irregular cycles are twice as likely to experience fertility issues compared to those with regular cycles. Ovulation disorders, such as PCOS or hormonal imbalances, can prevent the release of eggs, making conception difficult. Some causes of irregular periods, like hypothalamic or pituitary dysfunction, can impact the hormones needed for ovulation. If you have irregular periods and are trying to conceive, consulting a doctor can help determine the best approach for improving fertility. 10. Pregnancy complications. Higher risks for mothers and babies. Women with irregular menstrual cycles before pregnancy are at higher risk for pregnancy complications, including heavy checkmark preeclampsia, high blood pressure during pregnancy, heavy checkmark gestational hypertension, heavy checkmark preterm birth and low birth weight, heavy checkmark increased risk of miscarriage or perinatal death. One major reason is the high occurrence of menstrual irregularities in women with PCOS, which is linked to pregnancy-induced hypertensive disorders, PRHDs. These conditions affect 2 to 5% of pregnancies and can increase the risk of long-term heart disease for both mother and baby. If you have a history of irregular cycles and are planning pregnancy, it's essential to monitor your menstrual health and seek medical advice to minimize risks. If you experience sudden changes in your menstrual cycle, extreme pain, excessive bleeding, or have missed periods for several months, it's important to consult a doctor. Identifying the cause early can help prevent long-term health issues. The effects of irregular periods on the body go beyond just menstrual discomfort. They can indicate deeper health issues such as anemia, weakened bones, fertility problems, and pregnancy risks. By paying attention to your cycle and making lifestyle changes, such as eating a balanced diet, managing stress, and seeking medical advice, you can take control of your reproductive and overall health.